This episode of the Beauty by AVIC podcast is brought to you by the Aesthetic and Beauty Industry Council. Hello and welcome to the Beauty by AVIC podcast, your online support community for the aesthetic and beauty industry. Here, we are strengthening and unifying the industry through representation, innovation, and education. This is a platform created and dedicated to the aesthetic and beauty industry, valuing unity and advancement. We serve to represent, support, and inspire you by connecting you with industry experts, expanding your knowledge through educational pieces, and bringing you the latest industry news. This is Beauty by AVIC. I'm your host, Stephanie Miller, and today's guest is Dr. David Kozenko from the Cosmetic Physicians College of Australia. David graduated from Monash University in 1987 and became a Fellow of the Royal Australian College of General Practitioners in 1994. He always had a keen interest in GP dermatology and skin cancer medicine, and in 2007 he branched into cosmetic medicine, subsequently obtaining a fellowship with the CPCA. In fact, David now serves as president of the CPCA and regularly speaks at conferences, workshops, and webinars. He has a keen interest in teaching and regularly supervises GP registrars, mentors cosmetic medicine registrars, and teaches nursing and medical students in his clinics. He is passionate about the concept of lifelong learning and recognises that there is a lot to be gleaned by interacting with those from outside one's craft group. Here to discuss the present and future challenges in the evolving landscape of cosmetic, injectables, and medical aesthetics. From the Cosmetic Physicians College of Australia, today we welcome Dr. David Kozenko. David, welcome to the podcast. It's so lovely to have you back.
Thank you so much for asking me, Steph. It's lovely to be back.
Oh, you're always a favourite guest of myself personally, but also our audience. You are so knowledgeable in all things aesthetics. And for those that are listening that don't actually know who Dr. David Kozenko is, please tell us all about yourself and how you entered the professional aesthetic industry.
Okay, well, that's actually a pretty interesting story because I'm doing what I'm doing because of my wife. I've been doing general practice since the early 90s, and I guess close to 20 years ago, my wife, who unfortunately suffers with rosacea, one night came to me very, very frustrated and saying, surely there must be something you can do for my skin. What can we do better? And about the same time, I actually formed a friendship with a lady called Trish Winchester, whom you may know. She was the founder of Advanced Skin Technology, and we started talking. She introduced me to the products that they had, and they worked on Wendy's skin. Wendy's my wife. And, one thing led to another. Next thing I knew, I learned how to do some neurotoxin injections. And then I realized I really couldn't do everything that I wanted to do. So I learned how to do some dermal filler injections. I started going to conferences and, it just snowballed from there and started my practice, I think, 16 or 17 years ago, the cosmetic practice. And things have just soldiered on from then. And now I'm the current president of the Cosmetic Physicians College of Australasia and keeping busy on lots and lots of fronts, both work and education.
Goodness me. And, I hear the same story that people stumble across our industry and then they develop a passion for it. They realize the amount of change that you can really affect on someone's life in this industry. And then you almost become addicted to it and think, gosh, this is my career now. And it's so rewarding, isn't it? Being able to help so many people in a positive way. Because obviously in medicine, you deal with generally, people who are unwell and things like that. But our industry is, obviously that's really needed, but our industry does give people such a positive change in their life and their confidence levels. It's just so rewarding.
Oh, absolutely. And those reasons that you just mentioned are the right reasons to be doing the work that we do. There is another group of people who are coming through at the moment who I think find it a little bit on the sexy side, perhaps. It's a cool thing to be doing at the moment. And I'm not saying that those people are not going to be good at what they do, but they really need to think about their motivation and why they're doing it. You do really need to have a passion in whatever you do. I think the more passionate you are about your job, the more interested you are and curious you are, the more you're going to learn, the better you're going to be.
Absolutely. And in our industry, it really makes a difference to be, to be as good as you can be, because you're making physical changes to someone's appearance and helping them to enhance their lives. This is probably why this area has garnered so much attention lately. And of course, attention both ways, good attention and then attention from regulators and attention from people thinking, like, are we doing the right thing by our patients now? And lately there's been so many changes happening in the aesthetic and cosmetic space. It really is sometimes quite difficult to keep abreast of all of them, and they can be quite confusing. You are an expert in this space. Would it be possible to give our listeners a summary of those changes that have occurred, and specifically for when you're administering cosmetic injectable treatments?
So I guess you're talking about the changes in the guidelines that have occurred and the drafts that have just come out a few days ago that
Yes.
are being reviewed as well. Unfortunately, all this was triggered a few years ago as a result of some media reports about some fairly shady cosmetic surgical procedures. Well, not the procedures themselves, but the actions of a few people and the way it was promoted on social media and the sort of care that individuals were given and the aftercare or lack of that they were given. And there was a very few high-profile cases that really brought it to the attention of the regulators. And that instigated or started a review of the whole industry, how it was regulated, what sort of guidelines there were. And to be honest, it had been done a few times in the past. From memory, the previous time it had been reviewed had been about 2015 or 2016, and some regulations had been, or guidelines had been tweaked at that time. And I guess you can divide them into guidelines that concern medical practitioners. And so far, or currently, there really haven't been much in the way of guidelines for non-medical practitioners. So a lot of what you've heard about in the last few years really has been aimed at medical practitioners or doctors, whether they be surgeons or otherwise. The guidelines this year, in a nutshell, introduced a few important aspects. They provided a lot of clarity with regards to how old someone should be with regards to getting aesthetic procedures, and what the appropriate processes were for people under 18 wanting to get something done. It also spoke about the fact that some people that may come seeking aesthetic procedures may have some underlying psychological conditions that may affect the way they present to people. And they're talking about, body dysmorphic disorder has been the one that's really been spoken about a lot. But it also, relates further even to eating disorders or anxiety or bipolar disorder. There's a whole range of mental health problems that could affect someone's decision-making process and the way they see themselves and evaluate their appearance and what they ask for. Then the guidelines started looking at the consent process, what actually constitutes consent and what has to occur. And for the first time, it really highlighted that people have to get financial consent. So you have to get written financial consent from an individual each time you do a procedure, and appropriate follow-up care. The person that's having the procedure should get a copy of their consent forms as well. So there was a lot of things that were formalised, whereas previously, they'd been recommended. The new guidelines that came out for doctors on the 1st of July really made it black and white as to what was required. Following that, it branched into advertising guidelines, and the guidelines that have come out so far really specifically relate to cosmetic surgery. And I think there's been a lot of confusion, particularly in the media and with the public, as to the difference between cosmetic surgery, and I call it cosmetic medicine as being the opposite, but most people would say non-surgical procedures, because it all gets dumped into cosmetic surgery. If someone has a neurotoxin treatment or a dermal filler treatment, someone's said to have had cosmetic surgery on the basis of that. And we know that's not true. But nevertheless, the public and the media look at it to be one, and often the politicians do. The regulators have better insight, but not complete insight, unfortunately. And one of the things the CPCA was pushing was really to get them to understand the difference between the two. Having said that, the advertising guidelines at the moment relate to cosmetic surgery and not so much the non-surgical procedures. And that relates around before and after photos, the fact that you shouldn't be using stock photos. They should be your own photos. They need to be high quality. They need to be standardized so the before and after is taken in the same lighting with the same position. There's not jewelry or makeup or hair that's distracting from what the effect you're trying to show. It has to be your own work. And beyond that too, it's both with the consent process and the advertising, you are obliged as well to state who you are, what your qualifications are, what your medical registration is. So there's a lot of extra bits of detail now that we provide to patients that weren't required in the past. And finally, there's been some changes to the telehealth space, which will be very interesting down the track to see how that affects a lot of the businesses. Basically, with regards to telehealth, and this has always been the case, but I think it's sometimes glossed over by some of the providers, the medical providers I'm talking about in this case, and that is that any medical provider that provides a telehealth consultation for aesthetic procedures is expected to perform a consultation exactly the same as they would if the person was sitting in front of them. They should be, introducing themselves, checking their identity, taking a history, finding out what medications they're on, what allergies they have, find out what procedures they want to have done and why, explaining, what sort of, or if they don't know, what sort of procedures are available to them, talking about alternatives. They need to get consent from the person as well as the person they're delegating to. They also need to take their own history and consent. So it made it clear that those were still the requirements. Unfortunately, I know that doesn't always happen, and I think that's to the patient or the client's detriment because I don't think they're getting the service that they deserve to. And they also made points that asynchronous prescribing is now not allowed. So an asynchronous script would be where someone fills in a questionnaire through an app or something like that, and the doctor will chat to them through the app or something along those lines. So anything other than a face-to-face live consultation, be it through video or face-to-face, would be considered asynchronous. And that's really not allowed now for doctors. And the medical board has said that people who do that will be asked to explain why they're practicing in a way that they've been recommended against. So I guess I've spoken a lot about a lot of things, but in a nutshell, that's the change in regulations that affect medical practitioners at the moment.
And how do you think these guidelines, do you think they have made an impact in our industry? How do you think they have impacted our industry?
It's definitely created more paperwork for a lot of people, whether you're doing things right before or not. You have to document more things now. So, a lot of people would do a consent form for a particular procedure every now and then, but because someone comes back for the same procedure over and over, a lot of people weren't reconsenting them every time. And that was fairly common practice. I guess I compared that to what I do. I still do general practice. I do a lot of skin cancer medicine as well. And I must say that every time I do a biopsy or an excision on someone, I get a consent for that procedure every single time. So to me, that wasn't that foreign and it doesn't seem that unreasonable. But I know a lot of other people have found that tricky. Prior to the 1st of July, all the doctors had to go through all their social media from the past and either delete it or update it to be compliant with the new standards because the standards were retrospective.
Yes, so I remember
that. It has created a lot of work for a lot of people. I think the people that do the right thing and have always done the right thing are going to continue to do the right thing. And I think there's a group of people that always look at how they can possibly take advantage of things to shortcut it as much as possible and be as advantageous to them as it can be. Hopefully that doesn't compromise care, safety or quality that they provide.
I think there is still a lot of work to be done in the asynchronous scripting space and the video consulting. That seems to be what I'm hearing is probably the most impactful space apart from the extra paperwork. Yes. So it's changed the way that a lot of people have practiced in, or doctors and nurses have been practicing in the past. And I think some work needs to be done there. But in your opinion, do you think these guidelines were actually necessary? Do you actually think there's more work to be done in the regulation space, or are we there yet?
Look, that's a really interesting question. I don't see anything wrong with the guidelines, and I think sometimes you just have to put expectations in black and white to get people to understand exactly what's expected of them. And it's interesting that they're called guidelines for medical practitioners. But the fact is that if there is a complaint made or you come to the attention of the medical board, they're taken as the rules. If you breach the guidelines, you've broken the rules, and you're likely to be found of, guilty of unprofessional conduct or worse. So they're more than just guidelines. I guess the second layer is it's great to have guidelines, but they need to be policed in some way for them to be effective. There have to be some people, unfortunately, that fall foul of the guidelines and other people become aware of what's happened to sometimes get everyone to toe the line, if you know what I mean. So I think I know the medical board in UPRA has made quite a lot of noise about the fact that advertising's been policed a lot more than it has been in the past.
Yes.
And that's good. I mean, if nothing more, it's a level playing field. If everyone's playing by the same rules, there's not an unfair advantage, through breaking the rules. And I don't think that's a bad thing, personally. But I think policing with regards to some of the other practices needs perhaps to be tightened, to be able to make sure that, when someone goes to see someone for injectable, they're getting the service they deserve, the service that APRA is suggesting that is the minimum required to provide quality, safe treatments. So I look at it from that perspective primarily. I'm very much for patient safety and standards and making sure that everyone has a good experience and the risks are minimised.
And there are risks. It is not a risk-free. Just because it's non-surgical doesn't mean that it doesn't carry its own set of consequences. And I love the fact that you've given us a distinction between it's a guideline, but really those guidelines are enforceable and they're more than suggestions. They are almost regulation. They are, in fact. And it is something that when guidelines like that are put in place, the missing component here, and I would have to agree with you, is the adequate policing of it, or how do we make sure that these standards are being upheld in a global sense and across Australia. I love the level playing field in advertising. I think that was really needed, to be honest, because there's just so many variables. There's so many products available. And speaking on product, recently, I don't know if you've noticed, you probably have, but there's a boom in international injectables products becoming available on the Australian market. It is, in my opinion, so important to be informed of these new arrivals on the market and their claims. And I know you're also a proponent on that. Why is it so important that we know what is coming into Australia and what we are, in fact, using on our patients?
Sure. Globally, Australia has got only access to a very small range of products compared to what's available internationally. And that's both from neurotoxins and also from dermal fillers. So it was only a matter of time before other manufacturers realised that Australia is a fairly big market per capita and fairly lucrative, and Australians like their cosmetic injectables and tried to get a foothold here. So there's lots of products coming out, and the products do evolve. I mean, some products are definitely an improvement on what was available in the past. And when I think back to, various dermal fillers and people starting off with collagen and then moving on to some other dermal fillers, and there was maybe one or two products you could choose from, and they all felt much the same, to the big range where you've got a large variation in physical characteristics of the dermal fillers, so they can be used in all sorts of different areas. It's definitely been an improvement. And I think we'll continue to see improvements in products as time goes on. I think with regards to what's available in Australia, if you want to be safe, the best thing to do is simply to buy the product directly from the local sponsor. So the local sponsor is a company that has decided to take on the responsibility for importing a product, for getting approval from TGA, and in return for that very costly and time-consuming venture, they get the right to sell the product in Australia to injectors. And in fact, they're the only group that's allowed to sell that product. So if you're buying a particular product of filler, the only group that it's actually legal to buy that from is the sponsor in Australia. I know some companies get around that through having various group buying schemes and things like that, but technically it's not legal for me to buy a product and then to on-sell it to another doctor or a nurse. That's in breach of TGA regulations, basically.
The Aesthetic and Beauty Industry Council is Australia's peak industry body, representing the collective professional beauty and aesthetic, salon, clinic and spa community. Created for the industry, by the industry, our council is a collaboration of industry leaders who bring their commitment and specialised skills to raise industry standards, guide regulation and be a strong voice to government. At ABIC, our purpose is to provide an accessible and supportive organisation for the betterment of the professional beauty and aesthetic field, to enhance working practices and promote unity across the various sectors of the industry. ABIC's mission also includes being a trusted source of referral, education and guidance for clients of the beauty and aesthetic profession. ABIC is here to support our members through an extensive offering, including hundreds of valuable resources, HR support and industry expert facilitators to ensure your continued growth and success. Join us today and together let's safeguard the future of the beauty and aesthetic industry. Find us at www.theabic.org.au. At ABIC, we are here for you.
So if you want to be sure that you're getting the real deal, you buy it from the sponsor, which will be Galderma or Allergan, Teoxane, Dermacosmetica, any of those companies, Cryomed and Vogue. There's so many companies now that have got their own injectable products. But yeah, buying it directly from them is the best way to be guaranteed you're getting the right stuff. That way you don't have to look it up against the TGA all the time.
Goodness me. Speaking of that, I've heard some scams are actually happening in our industry. Is this true? And if so, how are we supposed to be aware of various scams that are happening?
We live in a global community nowadays, and part of the problems why I think advertising went off the rails is that when you go on a social media or you search something on the internet, you'll come up with sites from all around the world, and the regulations are vastly different around the world. So in the States, a pharmaceutical company in the United States can market directly to the consumer, which you can't do for any prescription or scheduled product in Australia. And there are other countries around the world which you can do that as well. So, someone may come across a United States site or Instagram page or feed or whatever, and they'll just openly talk about the product name and which one they use and whatever. We can't do that in Australia. Similarly with products, overseas, the regulations are different as well. So, you might have wholesale companies, and in Australia, we've got wholesale companies for various pharmaceutical products in medicine in general. So, for example, vaccines, there'll be a number of wholesale companies that'll get access to the vaccines and then sell them to pharmacies and surgeries. With injectables, it's different because there's no one that's got a license in Australia to do that. It's probably not impossible to do, but you'd have to be a licensed organisation. You'd have to get a specific license to be able to do that. But nevertheless, people approach from overseas companies or via web pages and things that are based overseas, offering great deals on injectable products, all the brands that we know here and even brands that we'd love to have that we haven't been able to get our hands on, i.e. they're not TGA approved, and they can get them and they mail order them and they get sent across. And there's several issues. One is you're breaking the law doing it. And the second thing is you don't know what you're getting. I mean, you don't know where the origin of that product is, and it's become quite well known that counterfeiting of a lot of these products is quite common overseas because, you know, you can make a lot of money. So, yeah, there's a scam on that level going on. And I mentioned to you just before we started talking today that in the last month, we've come across a booking site scam as well. And, you know, the consumer needs to be, you know, it's really buyer beware. But if you think of something like Expedia or booking.com or hotel.com, where you go onto a website, you can compare all the hotels and you choose the deal you like the best and you book. We all know that that works a lot of the time, but sometimes it doesn't. Unfortunately, there's a site that's doing similar things, claiming to represent various clinics, both, you know, very reputable medical clinics and beauty salons and injectable clinics around Australia. Basically, Melbourne, Sydney, definitely, and there was one other capital I think involved. The issue is that none of those clinics have any arrangement with this website. And if you look through the website, what they write about each clinic is taken directly off the clinic webpage, but the terms and conditions tend to be identical. The pricing is identical across all the clinics, which we know just doesn't happen. And they ask for full payment up front. So I dare say that if someone was to book on that site and pay, A, they wouldn't have a booking with the clinic that they thought they were booking with, and B, they've probably blown their money because, you know, the clinic wouldn't know anything about it and they're not going to honour that sort of booking and they don't have any formal agreement with that place. So there are some scams around. You've got to be careful.
Looks like there's, you know, you really need to be on top of what's happening in our industry because there's so many facets to keep kind of aware of, risks and safety concerns and issues. What you're just talking about with regards to clinical space, but also the product space. Just even with the registered TGA products, the ones that we commonly use in Australia, there's also risks associated with them. And these risks are talked about in conferences. And some of them are pretty scary. One of them, the most daunting ones, is, you know, the dreaded occlusion. It is something that strikes fear into many practitioners' hearts. And now, obviously, clients are becoming more aware of it. But tell us, David, how common is an occlusion? Is it something that happens a lot? Is it something that we all need to be aware of? Give us a little bit more information on it because I do think people are a little bit confused on this topic.
I think anyone that's been injecting for any length of time will tell you the more they inject, the more concern they get about the possibility of occlusions and adverse events. And they realise that the risk is a lot higher than they thought. I reckon the best analogy is, you know, having a needle and a syringe and plunging it into a bowl of spaghetti and hoping not to skewer any of the spaghetti. You know, when you're injecting into the skin, there are blood vessels everywhere. Fortunately, not all of them are large. Most of them are going to be small, and if it bleeds, and there's no problem there. But every now and then you will find a larger vessel, and if you're unfortunate enough to inject a dermal filler into that vessel, you can get an occlusion. And the problem may be minor or it could be severe. You know, the worst outcome is blindness. And the figures are a little bit hard to come by, but I think we're up to about 8 cases of blindness in Australia since 2018 as a result of dermal filler injections. General occlusions, that is getting into a blood vessel that's affecting, say, the viability of a block of tissue, which might be on the side of the nose or part of the lip or something like that, they occur on a daily basis. And through my association with AMET, you know, we're seeing reports very, very regularly. These are not rare events. And it's really important for people to understand what they are, how to recognise them, and what to do if one occurs. You know, ideally you can manage it yourself, but if you don't have the skill to do that, you need to know who to ask for help and not just palm the patient off and pretend nothing's happened. That's probably the worst thing you can do. But yeah, unfortunately, dermal filler occlusions in general are actually a very common event, much, much more common than we thought of in the past.
So percentage-wise, blindness is at a very low percentage, but if you talk to the 8 people that it's happened to, devastating. So a very real, they do say it's a very low risk, but a very real risk because it has happened, you know, several times in Australia, and occlusions happen daily. We have ABEC. I've got a strong relationship, and myself personally as well, with the team at ABEC for many, many years. Great work they're doing, especially recently with the introduction of AMEP. We didn't have anything like that in our industry previously, so I commend the work that they're doing, and also the work that they're doing with professionals such as yourself to make it safe for the industry. And yet, still I think it's underestimated what can happen. And there is still confusion there, because dermal fillers come in many shapes and forms. A question that I get asked a lot is, do skin boosters that are non-cross-linked, the HA's non-cross-linked, do they actually cause occlusions? That's maybe something that you can answer.
I think anything potentially can cause an occlusion. It doesn't even have to be an HA, it can be other dermal fillers as well. I think in general terms, the lower viscosity of the product has, the less likely you are to get an occlusion, but also, or have serious complications as a result of one, I should say. But also where you're putting it is going to play a big role. And if you're talking about a skin booster and you're literally doing an intradermal injection, your risk of an occlusion, look, it's got to be close to zero. You have to be so unlucky. The minute you start to go subdermally, that's where you start to occasionally find a vessel. And then there are recognised zones and areas where there's going to be, big vessels present, and every now and then someone is going to manage to hit that vessel, and then you can get into big problems. I think, the risk with uncross-linked products is much lower, but I wouldn't say it's zero. I still think you need to be aware, and it depends a lot on the technique you're using. If you're using, say, a V2 injector and you're just doing intradermal blebs,
yes,
depth of 0.6 of a millimetre, and each little bleb had 0.01 of a mil of dermal filler there, I can't see that you're going to cause a problem at all. So, its volume is important, location's important, and the higher the G prime, I guess the higher the risk in some ways too. If it gets in there, it's just going to be harder to budge.
Thank you so much for clarifying that. I completely agree with you. There's also adverse events. There's so many of them, but another one that comes to mind is that always gets brought up is filler migration, and particularly in the tear trough area. How common is that, and is that treatable?
I think it does occur. How common it is, I don't know that I can tell you. I think the more filler you've had over many years, the more likely you are to get problems with that. And yes, it is treatable depending on the product used, but if we're assuming that it's an HA-based product, then yes, you can treat it, you can dissolve it, and you can do it in a very, very targeted way, hyaluronidase. So if it's in the tear trough area, you can definitely improve it. Sometimes it's because it's not quite put in the right plane. Sometimes it's because there's too much there. Sometimes it's because of underlying anatomy, the natural tone of the muscles in the area and the intraorbital fat will make it more likely to bulge out, and you've sort of got that wrong. You haven't really perhaps planned as well as you could have in the first place. And look, we all get caught out sometimes and we misplace some filler. I think with regards to true migration, it can occur in certain areas, and certainly temples is one area where there's a communication from the temple down to the cheek. If you don't put it quite in the right plane or in the right place, or you put too much in, it can flow downwards. Again, dependent on the product you use and how high the G prime is. The stiffer it is, probably the less likely it is to flow. And I think sometimes you just see people who have filler and they have more over 5, 6, 10 years.
Yes.
And it starts to look wrong. There's not much normal fat and tissue there, and it's all filler. And it's one of the reasons I don't like permanent fillers, because if you put a permanent filler there, who's to say it's going to look good in 10 years or 20 years?
Oh, absolutely. Absolutely. Oh, goodness me. I think we've all learnt and come a long way in the industry when it comes to different types of fillers and all of our collective opinions on permanent fillers. Everything that we've talked about leads me to one conclusion, and that is obviously safety is the most important thing in our industry. how do you become safe? Well, you become experienced. How do you become experienced? You need training. And that's, I think, one of the areas that needs so much attention in this space is injectables training. How important do you think, ongoing training is? Obviously, initial training to get into the industry, but ongoing professional development in this space. And do you actually think that our training standards and requirements need to improve?
What a great segue back to guidelines. So, because you reminded me as we were talking, there's one aspect of guidelines I didn't bring up, which I will bring up in a moment. But with regards to training, the medical guidelines say that someone has to have adequate experience and be adequately trained and be undergoing a reasonable amount of CPD to keep up their knowledge in that particular area of special interest, being the cosmetic injectable treatments. So there is a requirement there. It's not spelt out in black and white. And I think training has improved dramatically in the last 15 to 20 years, because when I started, the training was all pharmaceutical company based. It was a couple of hours here, a couple of hours there. And it was some of the people that were doing the presenting were extremely knowledgeable and, fantastic people. But the sort of training that was provided by the company was really not comprehensive. And we were just let loose on the public, and you learnt as you went along. And I think that that's just not the way it should be. And, I'm embarrassed to say that's, the way I started, but that was just the way it was at the time. There really wasn't much in the way of training programs at all back then. Nowadays, there are quite a lot of training programs, both for doctors and nurses who want to do cosmetic injectables. And, at my general practice, I have registrars. They're coming through every year, and they commonly want to be involved in the cosmetic space. And I always tell them, look, if you want to do that, do a proper training program. Join, the CPCA registrar training program, which is the Graduate Certificate of Cosmetic Medicine. If you're interested in doing it from a nursing perspective, AACDS in Perth has got a great program for cosmetic injecting for nurses. And I think those sort of programs should become the standards. Look, there are other programs around Australia. These are two that I'm familiar with and that I'm associated with, which is why I'm bringing them up, but there are some other good ones as well, run by some of the other colleges from the doctor's point of view. But, the more you learn, the more you realise what you don't know, and the more you realise what the risks are. I think when you can have that sort of knowledge, and that's your approach to a patient or the client that comes to see you in your clinic, that's always going to be beneficial to them. With regards to regulations and guidelines, the one thing I forgot to say is I pointed out that the existing guidelines applied to medical practitioners at present. But about a week or so ago, APRA put out draft recommendations for nurses who perform cosmetic medical procedures and other practitioners who perform other cosmetic procedures, including advertising guidelines. And these draft regulations have been published on their website now. I haven't looked at them in great detail. I've just skimmed through it quickly. It does seem to parallel the requirements for medical practitioners, which I think is a good thing, because I think that produces a good standard of care. Doesn't matter who you see. It doesn't matter whether you see a nurse injector or a dentist who some neurotoxin injections or dermal fillers as part of their work, or a medical practitioner. You'll know that they're all working by pretty much the same guidelines. They can't have exactly the same ones for doctors, because we fall under the jurisdiction of the medical board. Nurses fall under the jurisdiction of the nursing and midwifery board. Other groups fall under other boards. So they've had to tweak them, but the general underlying principles are much the same, and they haven't been formalised yet. The consultation process, I think, is open until early February next year.
That's right.
But I expect, having observed how APRA works over the last 6 years or so, I expect that, if you start planning, that those draft guidelines are the one that's going to be implemented. You're probably going to be doing yourself a favour and saving yourself from a lot of work at the last minute.
I would suggest that you are absolutely correct. And I think the good practitioners out there and good nurses that are working with some really experienced doctors are already adopting the guidelines that have been put forward in the medical space and in that kind of already policed, if you will, guidelines that have come out. I think I'm starting to see that already happening in the nursing space. And it's wonderful that you actually brought up cosmetic nursing and training. I believe it is an area that we need to progress in. I actually think that cosmetic nursing is a fascinating sector of our industry because there are qualifications now for cosmetic nursing, but still it is not considered an actual occupation. And that's something that ABIC is working on very hard with the Australian Bureau of Statistics and with the government to actually recognise cosmetic nursing as an occupation, and then obviously the responsibilities that lie with that occupation. There's a lot of work to be done in our industry, and organisations such as yours and yourself personally, David, have been instrumental in creating that wonderful change. And ABIC love partnering with CPCA and yourself. Everyone needs to watch this space because we keenly want to work with you in the future. I think everything that you're about and everything about CPCA is so aligned with ABIC, and we're so glad that you are partnering with us and that you do give us the time to come and educate us and keep us abreast of all these changes. So I just want to thank you on behalf of our industry and also on behalf of ABIC. And it's been a real pleasure having you on the podcast again today.
Thank you for those very, very kind words. I feel humbled by that. I mean, like I said earlier, I just want to make sure that the person who walks in off the street and goes to see whoever for a treatment knows that they're going to be getting treatment of a very high standard with a product that is licensed for use in Australia, and people know what they're doing. I think that's the most important thing. It all has to come down to patient safety at the end of the day, and part of that means that the people that are providing the treatments need to be well trained. They need to talk with other people in the industry. There needs to be talk between the various groups, the nursing groups, the medical groups, the surgical group. I'm very much for a very collaborative approach to make sure that everyone's well looked after.
Well, we love collaborating with you, and hopefully we'll have you back on again very soon on our podcast and even maybe live soon. Thank you for listening, everyone. Thank you, David.
Thank you, Steph.
You've reached the end of another episode of the Beauté by ABIC podcast, your online support community for the aesthetic and beauty industry. Thank you for listening, and until next time, stay connected.